Aging is a very unequal business. If you're wealthy and you're healthy, you have resources, you have community, you have functioning family, you can age well. But if you have been very challenged across a number of domains, you will not age well.
Aging as a topic is really one that demands that researchers from different groups, different disciplines come together and talk about their work.
People from 30 countries of the world have come to Manchester for this 47th British Society of Gerontology conference to tackle the very big research questions of the day.
Really, it's a rallying cry for the Society to place inequalities at the heart of what we do.
I see a much broader, a more expansive view of what it means to be older, what it means to study ageing, and a lot less focus on, what is your discipline.
What we've tried to do in our research programme is to go further and show how and why class relates to health outcomes and well-being in later life. So exploring mechanisms at a social level, a cultural level and a biological level.
It's about the events that we experience. It's about becoming disabled or a widower. Some aspects of our working and family lives are closely associated with when these events happen in our lives, but social inequalities remain having a strong role.
It's really important not just to understand those inequalities at a neighbourhood level, but also try and identify strategies that tackle and mitigate some of the drivers of those inequalities amongst different populations.
Gerontology is at a crossroads, and what we're seeing through the industrial strategy and the Global Challenges Research Fund will be quite exciting for new directions of research, particularly working with business and industry, and also working much more in a global context.
We provide a lot of advisory work to transnational actors. So a lot of our research feeds into policies that are taken at the global level. We also work with governments, especially in low and middle income countries. And again, it's a matter of providing advice, providing accessible account of our research to policymakers.
If governments don't start to put inequality on their social agendas, they will not be able to cope with the way that their population ages.